Artificial Intelligence Doctor, www.abcpharma.net/English. User question: what is the role of venous insufficiency in the development of painful itching in the distal lower extremities, and how does it contribute to the inflammatory process? Claude AI answer: venous insufficiency plays a significant role in the development of painful itching in the distal lower extremities. This condition can contribute to the inflammatory process through several mechanisms. 1. Fluid accumulation and edema. Venous insufficiency leads to impaired blood return from the legs, causing fluid to accumulate in the tissues. This edema increases pressure on nerve endings and can trigger itching sensations. 2. Inflammatory cascade. The fluid accumulation initiates an inflammatory response, releasing pro-inflammatory mediators such as histamine, cytokines, and prostaglandins. These substances can directly stimulate nerve endings and cause itching and pain. 3. Skin changes. Chronic venous insufficiency can lead to changes in skin texture and integrity, including lipodermatosclerosis, hardening of the skin and subcutaneous tissues, venous eczema, inflammation of the skin characterized by redness, scaling, and itching, hyperpigmentation, darkening of the skin due to hemosiderin deposition. 4. Microcirculatory dysfunction. Impaired venous return affects microcirculation, leading to reduced oxygen and nutrient delivery to tissues. This can cause cellular stress and further contribute to inflammation and itching. 5. Increased histamine release. The inflammatory environment in venous insufficiency can lead to increased mast cell activation and histamine release, exacerbating itching sensations. 6. Nerve sensitization. Chronic inflammation can sensitize peripheral nerves, lowering the threshold for itch and pain perception. 7. Bacterial colonization. Compromised skin barrier function and edema can create an environment conducive to bacterial growth, potentially leading to secondary infections that further contribute to inflammation and itching. 8. Fibrosis. Long-term venous insufficiency can lead to tissue fibrosis, which may compress nerve endings and alter sensory perception, potentially contributing to chronic itching and pain. 9. Increased vascular permeability. Venous hypertension can increase vascular permeability, allowing more inflammatory mediators to enter the surrounding tissues and exacerbate the inflammatory response. 10. Altered lymphatic function. Venous insufficiency can impair lymphatic drainage, further contributing to fluid accumulation and the persistence of inflammatory mediators in the affected tissues. Understanding these mechanisms is crucial for developing effective treatments for painful itching associated with venous insufficiency in the distal lower extremities. Management strategies often involve addressing the underlying venous insufficiency through compression therapy, lifestyle modifications, and in some cases, surgical interventions, along with topical treatments to manage symptoms and reduce inflammation. Would you like me to elaborate on any specific aspect of this process or discuss potential treatment approaches?